The human joint is a highly active metabolic and mechanical zone. Every degree of rotation requires a continuous exchange of fluids, nutrients, and energetic resources. In clinical practice, when this biological machinery fails and pain sets in, the standard diagnosis often points to a localized stagnation of qi and blood caused by overuse or cold. This classical chart maps the flow of energy across the body, and practitioners traditionally visualize joint blockage by tracing these long, vertical meridian lines from top to bottom. Evaluating only the vertical pathways misses the internal, three-dimensional space of the joint capsules themselves. The meridians cross the surface, but the true metabolic exchange happens deep within the cavity. The physical integrity of a joint actually depends on a specific horizontal dynamic, the entering and exiting of qi across the capsule membrane. Treating joint pain effectively means looking past the surface lines and recognizing the joint as a three-dimensional exchange cavity with distinct directional forces. Human life requires the continuous transformation of air, food, and fluids into usable material. This physiological requirement is governed by the qi mechanism, a system of precise, directional movements that distribute resources throughout the body. This diagram illustrates the vertical axis, where ascending and descending movements manage major organs. It also defines a horizontal axis, where entering and exiting qi regulates local tissues. It explicitly identifies joints as cavities for this horizontal exchange, managed by the triple burner system. The capsules are not empty spaces for bones to hinge. They are regulated metabolic borders, dictating whether local tissue remains healthy or falls into dysfunction. When horizontal qi enters and exits the capsule in perfect balance, the joint remains free of pain and its movement is unrestricted. Joint pathology rarely manifests as a static, immobile block. Instead, the flow of energy becomes mechanically one-sided, creating specific directional failures. An aggressive outward flow creates the first pathological vector, excessive exiting. This depletes the internal cushioning, forcing surrounding sinews to overcontract to maintain integrity. The joint becomes rigid, and extension becomes difficult as the tightened tissues refuse to lengthen. The opposite mechanical failure, excessive entering, floods the joint space. This inward pressure overcompresses internal structures, causing the outer supportive capsule to become lax. The joint feels weak, and internal congestion makes the inward movement of adduction difficult. A diagnosis of simple stagnation is incomplete. To resolve the biomechanical restriction, the practitioner must determine the exact directional vector failure occurring within the capsule. We can observe this dual-axis model in the upper extremities, specifically within the architecture of the shoulder joint. The primary vertical movement tracks the yang channels, the small intestine, triple burner, and large intestine, flowing continuously upwards from the fingertips to the face. This chart shows that beneath this vertical flow, an essential horizontal exchange occurs across distinct energetic layers. The shoulder relies on an exchange between the superficial greater yang and the deeper bright yang layers, connected by an energetic hinge. Repetitive physical movements strain these structures. The mechanical overuse traps energy within these layers, disrupting the horizontal exchange. The local layer dynamics break down, resulting in the deep pain and motor impairment characteristic of chronic shoulder conditions. The vertical conduits remain intact, but the repetitive strain locks the joint's energetic hinge, transforming the tissue into a malfunctioning horizontal trap. The lower extremities present a different vulnerability. The knee acts as a primary locus for weight-bearing and complex fluid transport. Its large, exposed cavity makes it a target for external climatic pathogens, such as wind damp, which have a specific affinity for invading major joints. When an environmental pathogen breaches the boundary, it begins dismantling the internal physiological balance. The local yin-yang equilibrium is immediately compromised. In response, the body halts the local flow of qi and blood to isolate the core from the threat. This defensive mechanism shuts down the outward pathways. The knee capsule is forced into a state of excessive entering. Because the normal exiting flow is blocked, fluid accumulates. The patient presents with arthritic swelling and weakness in the lower extremity. Environmental pathogens push the joint's qi mechanism into a state of collapse, overriding its natural regulatory flow. Reversing complex directional joint pathologies requires an intervention that physically resets the mechanical vectors of the tissue. For the knee, practitioners target a specific depression on the lateral aspect of the patellar ligament. A needle entering the capsule is a precise physical intervention into the compromised structural matrix of the joint. The local stimulation reopens the restricted exiting pathways of the capsule, dispelling the trapped dampness. As the bidirectional horizontal flow is restored, the excess fluid drains, the swelling reduces, and the structural weakness vector is reversed. Acupuncture serves as a directional correction valve. It is designed to mechanically recalibrate the specific axes of the qi mechanism. Human movement requires a tightly integrated system of energy transport and precise metabolic exchange. The primary vertical meridians deliver the essential raw materials required for life across the length of the body. But the stability and health of the tissues, especially within the joints, relies on the horizontal entering and exiting of that energy. Resolving joint pain demands that a practitioner evaluate the structural vectors of the triple burner cavities, rather than relying solely on linear maps. A rigid joint demands an intervention that stops excessive exiting. A weak joint demands an intervention that stops excessive entering. Every joint capsule operates as a localized site for the same transformation and transportation mechanics that sustain the entire body.